Let's go on and talk about some medications that are used for urinary tract infections. And the first one we're going to look at is furodantin. This medication is used for urinary tract infections, and some of the side effects you may see are it may have instigate an asthma attack, and the patient may experience diarrhea. What you'll do with furodantin, again, it's an anti-infective medication, should be given with food or milk, and while the patient is taking it, because of the possibility it may stimulate an asthma attack, you want to monitor the patient's pulmonary status. Another medication that is used for urinary tract infections is mendelamine. This medication, again, is an anti-infective. One of the side effects you will see is it will elevate liver enzymes. Again, this medication you want to be checking the liver enzymes, the AST and ALT. This medication you'll give with cranberry juice, and again, remember cranberry juice is used to acidify the urine. Also, not only do you want to actively acidify the urine, but you want to limit the intake of alkaline foods by the patient. And these are foods such as vegetables, milk, almonds, and coconut. They would cause the urine to become alkaline. Another medication used for a urinary tract infection is pyridium. Pyridium is a urinary tract analgesic. The side effects you will see with pyridium are headache and vertigo. What you'll do with this medication is you want to make sure and tell the patient that their urine will become a bright orange. Otherwise, the first time they void, they will run out of the bathroom screaming because they think something is very wrong with them. And again, the pyridium should be taken with meals. The next category of medications we're going to talk about are the anticholinergics. And before we talk about the examples, let's talk about what this category of medication does. What it does is it acts to inhibit the action of acetylcholine, and it blocks the parasympathetic nerves. So it affects the heart, it affects the eyes, it affects the respiratory tract, the GI tract, and the bladder. So what you will see with these use of these medications are a decreased GI motility, decreased salivation. It will dilate the pupil, which is mydriosis. It will increase the heart rate and may cause urinary retention. The examples of the anticholinergics are probanthine, atropine, and scopolamine. Again, under action, what it does is it dilates the pupil. It can cause bronchodilation and decrease secretions in the respiratory tract, which is why sometimes it's used preoperatively. It can decrease GI motility and secretions. And it is used for the ophthalmic exam because it dilates the pupil. It is also used for motion sickness and used preoperatively because of the bronchodilation and the decreased secretions in the respiratory tract. Let's take a look at the side effects you'll see of the anticholinergics. They can cause blurred vision, dry mouth, and urinary retention, and there may be a change in heart rate. Again, it sometimes increases the heart rate. The nursing considerations for the use of anticholinergics are you want to monitor the patient's output. Remember, normal output is about 1,500 cc's per day. These medications are contraindicated with glaucoma because they do dilate the pupil, and that would interfere with the drainage of the fluid in the eye. These medications should be given 30 minutes AC or before meals at HS, or 2 hours PC, which is after meals. Again, we talked about they're contraindicated with glaucoma. They're also contraindicated with paralytic ileus, ulcerative colitis, and benign prostatic hypertrophy, again, because of the possibility of urinary retention. Let's go on to the anticoagulant medications. The anticoagulant medications are a frequently tested topic on the NCLEX exam. And the first kind of, or topic when we're going to talk about is heparin. Again, we're going to talk about heparin and Coumadin, and you should know the different medications and how they work and how they're different. Heparin blocks the conversion of prothrombin to thrombin. So, and it is used for pulmonary embolism, venous thrombosis, and prophylactically after an acute myocardial infarction. Now, side effects of heparin, it can cause hematuria, which is blood in the urine, and it can cause tissue irritation. What you'll do for patients receiving heparin, again, this medication is given either sub-Q or IV, not orally or other ways. You'll want to monitor the clotting time or the partial thromboplastin time, which is the PTT. Normal is 20 to 45 seconds, and for the heparin to be therapeutic, you will take the normal and multiply it times 1.5 to 2.5, because what it will do then is it will get you in a therapeutic range. Not enough heparin will not prevent the coagulation. Too much heparin will cause spontaneous bleeding. So again, one of the frequently tested questions on NCLEX is would you give the heparin or not if they give you the patient's PTT? Again, the thing to remember is the antagonist for heparin is protamine sulfate. Again, the heparin we said is given either sub-Q or IV. And one of the things when it's given sub-Q into the abdomen, remember you do not aspirate before you give it, and you do not massage after it is given. Let's go on to the next anticoagulant, Coumadin. You'll see that this acts differently than the heparin did. Coumadin interferes with the synthesis of vitamin K-dependent clotting factors. So again, very different action. Again, used for the same type of things that the heparin is used for, the pulmonary embolism, venous thrombosis, and after an MI. Let's take a look at the side effects of Coumadin therapy. It can cause hemorrhage, as again heparin can. It can cause alopecia, which is loss of hair. Now, the nursing considerations for patients receiving Coumadin are you want to monitor the prothrombin time. Again, note that the test is different. The test is different because, remember, the medication acts in a different way. So you will monitor a different test to evaluate its therapeutic level. Normal PT is 9 to 12 seconds. The therapeutic range to make sure the patient's getting enough Coumadin to be effective, but not too much so there is spontaneous hemorrhage, is about 1.5 times the control. And the antagonist, again, because heparin and Coumadin work differently, it has a different antagonist. And the antagonist is vitamin K, which is aquamaphytin. Patients receiving Coumadin, again, this medication is given PO, very different than the heparin, but you'll want to monitor them for bleeding. And patients receiving both heparin and Coumadin should avoid the use of aspirin because it interferes with platelet aggregation and may cause bleeding. Okay, let's go on and talk about the anticonvulsants. They're different type of anticonvulsants and they act slightly differently. But some of the medications that are considered anticonvulsants are Dilantin, Luminol, Depakote, Tegretol, and Klonopin. These medications act primarily by decreasing the flow of calcium and sodium across the neuronal membranes, and they're used for seizures. Let's take a look at the side effects you'll see of the anticonvulsants. They can cause respiratory depression. They can cause aplastic anemia. Several of them cause gingival hypertrophy, which is overgrowth of the gums in the mouth, and they may cause ataxia, which is dizziness. The nursing considerations for anticonvulsants is they should not be discontinued abruptly, and you'll want to monitor the intake and output of the patient receiving these. And again, patients that are prone to seizures, you want to use caution with medications that lower the seizure threshold. And these would be medications such as your MAO inhibitors or your antipsychotics. The anticonvulsants, for the most part, should be taken with food. And again, you want to give them good mouth care because of the possibility of the gingival hypertrophy that may occur. With the anticonvulsant medications, the patient should avoid the use of alcohol. And when they first start taking the anticonvulsant medications, the patient may become drowsy. So you want to make sure they are not doing any activity such as driving a car that requires mental alertness. And some of the medications, some of the anticonvulsants may turn the urine kind of a pinkish red or a reddish brown. And again, the patient should know that before the regime is started, so they're not worried that they have some other exotic disease in addition to the problem with seizures. Let's go on and talk about the antidepressants. And when we talk about the antidepressants, it's kind of like when we talked about the antibiotics. There's several different categories or classifications of antidepressants. We're going to talk about the MAOI, which is the monoxamine oxidase inhibitors. We're going to talk about the SSRI, which is the selective, let me get the right term here, the selective serotonin reuptake inhibitors, and we're going to talk about the tricyclics. Let's start first with the MAOI, or the monoxamine oxidase inhibitors. Some examples of this are Marplan, Parnate, and Nardil. What these medications do is they interfere with the concentration of the neurotransmitters, and they are used for depression or chronic pain. The side effects you'll see with the MAOIs are it can result in a hypertensive crisis if they are taken with foods that contain tyramine. And the foods that contain tyramine are aged cheese, liver, yogurt, herring, beer and wine, sour cream, and pickled products. And again, the hypertensive crisis, if the patient undergoes one of these, what happens is they suddenly have a severe headache, they are diaphoretic, they experience palpitation, they may complain of a stiff neck, and they may have intracranial hemorrhage. So it is a severe and significant interaction. One of the other things to know with the MAOI is that it potentiates alcohol and other medications, so it should be used very cautiously with other medications. So we talked about the side effects, the hypertensive crisis when taken with tyramine-containing foods, and the photosensitivity. The nursing considerations, of course, you want to avoid foods containing the tyramine, and again, some are listed here: the aged cheese, bologna, pepperoni, salami, bananas, raisins, beer. Patients receiving MAOI, you want to monitor output, and one of the things to remember is it takes about 4 weeks for these medications to become effective, so you will not see action right away. You don't want to combine the MAOIs with central nervous system stimulants, sympathomimetics, or vasoconstrictors. Also, they should be taken very cautiously, if at all, with cold medications that contain pseudoephedrine or some of the medications in cold medications, because again, it can result in a hypertensive crisis. So one of the teaching things you want to do is if your patient is taking an MAOI, you want to let them know what medications, over-the-counter medications, are safe for them to take if they develop a cold. Otherwise, they may be medicating themselves with something over the counter that will result in a hypertensive crisis that can be life-threatening. Let's go on and talk about the next category of antidepressants. These are the selective serotonin reuptake inhibitors, better known as SSRI. Some examples of this are Prozac, Paxil, and Zoloft. What these medications do is they inhibit the central nervous system uptake of serotonin. These medications are used for depression, obsessive compulsive disorders, and bulimia. The side effects you will see with the SSRIs is they can cause anxiety. And you might say, well, wait a minute, these are antidepressants and they're going to cause anxiety. Well, they may. They may also cause GI upset. They may change appetite and bowel function, and they may result in urinary retention. So the nursing considerations for these medications, again, because of change in appetite and bowel function, we want to monitor the nutritional status of the patient. We want to monitor output because of the possible urinary retention. But more importantly is, with these medications and several of the other antidepressants, we want to monitor for suicide. Again, the suicide precautions need to take place all of the time, but they are most likely or suicide is more likely to be an issue about 2 weeks after the patient is started on the medication. And again, this is the type of medication, the SSRI. It takes about 4 weeks for the full effect to be seen. And these medications should be taken in the morning. Again, the SSRIs may change the urine to pinkish red or pinkish reddish brown. Again, the patient should know about that. If the patient has the GI upset, these medications can be taken with meals.